Dr. Kevin Kavanagh joins us. Good morning, doctor.
Good morning, sir.
How are you?
Well, very good. Good day. Nice rain yesterday, so I'm ready to go.
How was Father's Day?
It was very good. I was FaceTimed by all of my children, and it was a good Father's Day.
You know, when you have them spread out like that, isn't it nice to be able to do that?
It is. It very much is.
Well, at least 12 states saw a record number of new cases of COVID over the weekend. They've jumped about 15% nationwide in the last 2 weeks. They say more young people in the South are testing positive, and yesterday a White House advisor said the administration is preparing for a possible second wave in the fall. What do you make of all that?
Well, it's concerning. I should add that the states that are testing positive or more positive are doing so with a huge spike. And that's something that's very concerning. It's not due to increased testing. Arizona, for example, over 2 weeks went from 700 cases to over 3,000. Florida from approximately 800 to over 3,000. So this isn't due to increased testing. And not only that, but if you increase testing, you would expect cases to fall because testing, you identify cases, they self-isolate, you do case tracking. That's how you drive the epidemic downward. So the whole narrative of it's due to increased testing is probably a false narrative. The younger people, well, this is concerning. This is all the beach parties, frat parties, bars, etc. that we've talked about that have been so concerning. Now, people may say, well, they're not as likely to die. Well, maybe, but they can still get extremely sick from the virus. They could still have difficulties with recovery. And although you may survive the virus, that may be not the same as truly recovering from it. So if you're very sick from this, it's dangerous. You want to avoid it. And the young people may well infect their parents and grandparents, which several weeks from now may then get sick and will be in even a worse situation. So overall, this is very, very concerning.
I noticed that 83% in one poll, 83% of Americans say they're extremely worried about the nation's future right now. And I guess that has to do with COVID, but everything else that's going on. And hospitals around the country have been stepping up their use of that specific steroid to help treat patients. A study last week found it's extremely effective and can save lives, but only in severe cases.
Well, that's correct, and that's dexamethasone. That's anybody who requires oxygen or who requires being on a ventilator, this will help. And you need to remember, we also have remdesivir. They have learned about proning. We have serum that can be given. This disease can cause blood clots, which causes significant problems, so they've learned to anticoagulate people. So all of this is causing the fatality rates of this infection to decrease. But that still doesn't mean that you won't have sequelae when you go home from the hospital. That's one of the things that really concerns me is that everybody says, well, they've recovered. You know, they really haven't recovered. They've survived the acute infection. If you're very sick, it's going to take you some time to recover. So this is something you want to try to avoid. Don't go thinking you can go out and party, not social distancing, not wearing face masks. Please do that. And the other thing that is very, very concerning is, and this is actually good news, is that if you wear a face mask and you socially distance, that in itself should drive out this epidemic. And unfortunately, people right now have not accepted that and are not doing that. But this is what we need to be doing. We can keep the economy open. We just need to do it safely.
Anything else we need to know?
Well, Jack, that is really about it. Just please wear your face masks. If you see someone wearing it, remember they're wearing it for you, for your safety. They can be an asymptomatic carrier that can run up to 45% of those infected. And please, that is an important consideration. Wear your face mask, socially distance, even if you have a face mask on.
Sounds good to me. We'll talk to you again on Wednesday. Thank you.